anything from the history, which is how historically white.
Oh, it just says she has to see an injury and then she'll be right back.
Okay. Historically speaking, we have treated Black people and the BIPOC people as less than. We've Dr. Cartwright came up with drapomania. I think I might be pronouncing it a little wrong because, which means, what did it say? That Black people are prone to laziness and that they have less feelings.
Right. Yeah.
And then we've got the Henrietta Lacks issues. Anything about gynecology came from there. We have what was the most disgusting breeding situation from former slavers who used them as experimentation. We have Tuskegee. We have the other medical things that have been done in different cities that they were putting, maybe we could mention Pennsylvania, Philadelphia. They also did it up in Chicago area where they were spraying, dropping pesticides and trying to hurt the areas most areas that are in a poverty level and or have a large amount of BIPOC people tend to be in very bad environmental places, which leads to more health concerns and they're not seen as actual people. They're seen as less than and that they can take more. The mortality rate for a woman in
labor.
Thank you, Kelly. Neptune, your job's being taken away from you here. They're more likely because Kelly's being helping me with my words today.
Okay. I was taking care of I was getting rid of a very nasty troll.
Oh, okay. Thank you.
I went before I needed to block them. I went and looked at their profile. Yeah, that was somebody we did not need in here.
Okay. They're also more likely to not get the prenatal care.
Correct.
On top of not having the mortality rate. Black men are black people of color in general are treated differently
I was also going to say, I think Kelly and Catalina are more. It's more appropriate for them to talk about it than someone.
Oh yeah, I know. I'm just going over some points, and then of course Kelly, who's in the field, and later on, I think Danny said she might stop by because she knows as a YT person. I'm trying to invite some more BIPOC people, but it seems like
Danny also said she was going to be in an area that she couldn't really charge her phone.
Medical privilege. So, Green Kelly, do you want to talk about this? And because I don't know if everybody here knows
my mother was a Black woman.
Yes.
My biological mother was a Black person. Yeah, she was. Indigenous also. Irish, English, Black, Indigenous. And she was rated and constantly called crazy for any issues she had growing up. Yeah, absolutely. She had a miscarriage and people didn't really give a shit because she was stronger than white women.
I can't tell you how many times they dismissed me. I've been dismissed so many times, like, oh, you're just okay, you're okay. Just go home and eat more fiber, and yeah. One time it was my appendix. They said they were confused because there was pain on both sides of my abdomen. And they were just, ready to send me home. But then another doctor came along and they did exploratory surgery and found that a cyst was fusing with my ovary and my.
Catalina, hold on a second. I gotta address something. Klaus, go away. We know you're a troll. We know you're a shit, sir. Go away or be quiet. Sorry about that.
I don't care what Klaus says. He has no weight with me. But anyway, also, now that he changed the subject, even up in Canada, the Native Americans up there are treated so badly.
Yeah,
They're constantly dismissed. They had the schools there that they were literally using for as experiments to try these to test their diets out. What can be sufficient and deficient quantities. They were guinea pigs. Some kids would run alive by from the results of it.
Yeah, absolutely. And we need to, how about the fact that they used BIPOC bodies to experiment on, to genocide? I don't know if I'm allowed to say a word, but I said it anyway. Native peoples, even not I'm not talking way back when, I'm talking now. How about what happened in Puerto Rico in the 60s, 50s and 60s? What we did to the Puerto Rican women, what we've done in other parts of this country to indigenous and BIPOC people and sterilize them without their consent in modern history.
Just recently in those camps that they had outside of Texas, where
Yes, ma'am.
refugees during the Trump administration were coming through. And a lot of these women were actually given hysterectomies if they had even one complaint about their body and wanted to see a doctor. It's documented.
And of course, we have the Schmortion thing that is an issue for all women, but it affects more of the BIPOC community because of the resources to get to a state like ours to get the health care that they deserve. And they're just not, there's just so much. And I know Kelly has some stuff from working when she's ready, working in this field and seeing it with her own two eyes, the differences between, even during the COVID pandemic, of what they would do for the YT patients versus what they would do for the BIPOC patients. If she's around. Are you around, Red Kelly? I didn't see. So maybe not didn't. No. I don't think she's around. How about Kelly, Green Kelly? Since you know the differences with your mom, when you went to have children, were you treated the same way your mom was?
No.
What differences did you find having, obviously knowing what your mom went through? What specific differences did you find just because of your color?
being white tea presenting, with a background, I am as white can be, by the way. So, I am treated, I would say better at times, but women in general aren't treated well
Sure.
in a lot of environments, which is why I always go towards female practitioners, especially members of the BIPOC community, because if I tell somebody that my mother was a Black woman and I'm having trouble with my perimenopause currently, or my anxiety or whatever, they listen to me differently. They listen to what I'm saying and what I'm expressing. Whereas YT male doctors are more apt to give me a diagnosis of depression, which has happened many times to me. When it actually legit was a physical thing that could have freaking killed me. And I have been gaslighted up the wazoo.
I am sorry for that experience. I had female doctors except for with my son. Does that mean?
Well, I went in because I had, my case was I was new to the area. I wasn't feeling good. I just had a baby. I had vertigo, severe vertigo. And
My first one, I had severe postpartum depression.
No, I had legit vertigo. I had vertigo. I had a migraine for an entire month.
Oh, Lord.
And nobody could help me. But you know what that doctor said to me? He's like, have you ever seen those commercials? Have you ever seen those commercials where they say depression hurts? Well, I think you're dealing with depression. I go, with vertigo? And are you kidding me? He's like, well, I see in the past that you've had some trauma in your life. So I think that this is just a recurrence of depression. And I said, I'm sorry. The room is spinning and you're telling me I'm depressed? And then I started crying. And then he goes, you see, you're unable to manage your emotions. By the way, my tooth was infected so badly that I had a large cyst pushing on my brain. And that had I not gone to a dental visit, I would have died within the month. And a Latina woman diagnosed me. A Latina woman found it. A Latina woman said, this is a problem. A Latina woman said, hey, you need help right now. I would like you to go straight to the ER. Yeah.
That happened. A friend of mine. It was actually just before September 11th. We had to rush him to the hospital because he was curled down in pain. Middle Eastern man, Air Force, but he was in obvious pain and he kept coming in and out of consciousness. And they let him lay on the floor for hours and hours without any checking. And they just kept telling him, oh, it's just indigestion. It's blacked up bowel. They got him finally back to surgery like 8 hours later. His appendix had ruptured. They kept dismissing him. This was a military base or military hospital too. They just kept dismissing him as, bowel obstruction or something, and his appendix had ruptured.
Yep.
I know from this one experience, I'll talk about why, Kelly's with her patient. My daughter, when my daughter gave birth the first time, she was young. She's only 18, going on 19, and she's Latina. This is the only time we'll ever use this, okay? And she, they were like, oh, they didn't believe her until I had to go to the doctor's appointments and I had to flip out on people. While she was in labor, her blood pressure skyrocketed. And they were going to say, F it, they were going to give her a C-section. She didn't want that. And I know she didn't want that. So I had them push magnesium and told them to leave me with my kid. I got this. They pushed the magnesium. We let her go to the bathroom. And then I had them push some medicine in her. I forgot which one I used. It's more of like a calming and pain. I forgot the word. Not like Dilaudid or anything. So she can get some rest. And hook her by crook, she rested for a few minutes, and about 20 minutes later, she started pushing, and my grandson came out perfectly fine. 2 days later, her blood pressure was back up. She wasn't feeling well. I took her to the hospital. They made her go to the maternity ward. And it literally took me calling in her psychiatrist because they were telling her that she had PTSD, postpartum depression, and they weren't going to let her leave the hospital. My grandson's only 2 days old, or maybe 3 at this point. And I'm like, oh, she's not staying here. She won't stay here. You're making her more upset by saying it. The doctor was a male, you're right. And I said, I don't want you in this room anymore. Get out. You will listen to her psychiatrist, and she's going home. Bring me the paperwork now, because I will sign that we are leaving against your fucking idiocy. Because she has a psychiatrist that she will be seeing. And don't forget to prescribe her a blood pressure medication. And I was dead serious, and I had to do that. And because they weren't listening to her because she was young and Latina.
Of course.
But mom came in, and mom's obviously, well, I guess not obviously not, but mom came in and flipped the script and had to get other medical professionals who knew my child to make sure that she got home, and that they called in. I mean, there was no virtual back then. I mean, there probably was, but we didn't have it yet. 2015, when my grandson was born, she did a lot of sessions over the phone every day until she was able to come out, and I would watch the baby. I'd take her there and everything, but they were going to leave her in the maternity ward because they decided that she was being too erratic, aggressive, and stubborn, and not listening to medical advice that was not really good medical advice.
Because she was advocating for herself?
Yes, and they didn't like that, and when I advocated for her, it was like a totally different story. Because, well, mommy's last name's is not Martinez anymore.
Mama Grizzly.
What? Yeah.
Mama Grizzly.
Yeah, I mean...
Yeah, Grizzly Bear Mama.
Mm-hmm. Oh, yeah,
No one interferes with your cubs.
Oh, hell no. I mean, when she was pushing, right? And by the way, she did get a really good doctor. It was the nurse who was an idiot. So she got this older doctor, really nice white lady. And so when I was helping, I had her leg, and then I was holding her stomach and, helping her go through it. She's like, how many kids do you have? I said, 4. And I've been a coach for 2 other people. She goes, I know that's your daughter, and you go ahead and do it, but I haven't seen anybody help massage the baby out before. I was like, well, now you have. Because I was, I'm hands-on. I'm totally hands-on when it came to my kids. And, yeah, it's just who I am. And it's unfortunate that because I mean, I'd be like this no matter what their last name was, but because of their last name and the two older ones, they're YT passing, but they open their mouth and they got the dark hair and olive skin. You can kind of guess. And plus, they're from the city and they have their accent. I don't. Well, I can, but I don't use it. So yeah, I mean, there's so many different reasons why she was treated differently than I was treated when I got there. She was treated when I got there because she's young and Latina, and that's not supposed to be any part of the Hippocratic. How do you say that word again?
Hippocratic.
Oath. It does not say anything about, if they're this, that, and the third, you're not going to treat them correctly. And I can only imagine how they treat LGBTQIA plus people. And I don't have do I have a trans person today? No? How do I not have any trans people on here?
Dylan down there? Dylan was in the comments earlier.
Was it? If there is anybody that is transgender and would like to come up and tell us about your experiences, please do so. I will go send out some more invites.
I'm going to add to it, in the medical field too, the amount of slut shaming. And I will say slut. The amount of slut shaming. When I was giving birth to our youngest,